Kleszcz from Poland, and Mrs. Kleszcz is present, so I am giving the floor to her for 5 minutes. Do you have problems?
Yeah.
No. Yes, it's okay with that microphone. Thank you.
Szanowni Państwo, chciałabym Państwa poinformować, iż w dniu 8 lutego 2014
Ladies and gentlemen, that I have not had official support from my petition in Brussels. There is an organisation from 15 member states, and it was stressed that it was said in the Institute for European Affairs
I would like to thank you for giving me this opportunity to address the European Parliament today on behalf of Polish patients and all those that are stuck in hospital. I am not a doctor, nor do I represent an association. I'm a patient, a European Union citizen. I would like to speak here on behalf of those suffering severe pain. I would like to tell you about my traumatic experience. It has brought home to me how serious the situation is facing patients in the European Union. The statistics are really quite striking. 5.5 million patients suffer from pain. It is quite shocking that in the 21st century people are still suffering because they do not have access to the right form of pain medication. The UN has noted that if pain is not treated properly, this is an infringement of human rights. Fundamental rights must be respected, and so I turn to you. I would call for uniform standards when it comes to treating pain. Pain can hit us all, regardless of where we live. You, me, any of our relatives or friends might be affected, and so I would appeal to you to put an end to this injustice in the European Union. Let me just illustrate the current state of play. In 2013, in Germany, 413 forms of medication were used. 648 in the US and 45 in Poland. Patients should not be penalised if they choose to use opiates. There are good practices in this field. In the UK, patients can use opiates and continue to drive. There are doctors that deal in particular with pain management. The European Union has tools to encourage the member states to act in this area. Research, for example, a project is underway for research centres from a number of member states. The aim of the project is to produce recommendations for different member states to ensure that controlled drugs are available in this area. Funds could end up being wasted, though, because the data is 10 years old, from 2002. I know that the European Union acts as a support when it comes to the health sector. However, I believe that common European Union guidelines would help to even out the disparities when it comes to pain management and medication. millions are being lost as a result of this problem. I believe that this is something that needs to be borne in mind in these times of financial crisis. That is why I would appeal to you. I would call on the European Commission to develop standards when it comes to pain management, standards that would apply to all patients, all of us. I would like to thank you for your attention on behalf of all patients, and I look forward to hearing your response. Thank you.
Thank you to you. And now the floor to Mr. Werner from DG Sanco.
Yeah, thank you, Madam Chair. Dear petitioner, I'm speaking here. I have been reading your petition in detail, and we can agree to a certain extent to your petition. As you have been saying already, the European Union does not have a whole competence in that area. And therefore, we will be not able to come to guidelines which are applicable to all member states. In our opinion, it would be better to encourage non-governmental organizations such as the European or Pain Alliance Europe to draft guidelines and then to agree with the national organizations in that area. Of course, the Commission would be ready to support non-governmental organizations by dispersing those guidelines to other member states to enforce cooperation between member states. And last but not least, we would be ready, if this would fit to the annual work plan of the health area of the Commission, to support by financing through our health program projects which would deal with that pain problem in Europe. Thank you.
Thank you for your availability, and the floor to Mr. Wałęsa.
Dziękuję, Pani Przewodnicząca.
Thank you, Madam Chair. Thank you to the petitioner. I fully agree. We really do need to take action to establish common rules and standards. I listened to the Commission representative, and what I have heard was not satisfactory. Would the time now be right for a citizens' initiative in this field? Perhaps we could collect 1 million signatures. If that were the case, then perhaps the European Union would recognise that this is a problem that the European Union really does need to tackle. The Commission representative mentioned NGOs. It is true that they could be involved in this particular issue. We certainly would like to see the Commission dealing with the problem that's been mentioned. Thank you.
I have the text of Lydia Geringer, the Edinburgh on the Dear colleagues, first of all, I would like to apologize for not being able to attend today's meeting and personally express my support for this cause. The petition of Anna Kleszcz on the introduction of uniform European procedures for the treatment of chronic pain is a very important one. The petitioner explained to us her dramatic struggle through her illness and how doctors in Poland refused to use appropriate analgesics to ease her unbearable pain. This is also reflected in national statistics, where the use of morphine in Poland is 10 times lower than in Germany. I agree with the United Nations report, published last year in February that the refusal to administer painkillers to patients in a form of torture. It is unthinkable that there are such cases in the European Union. In this regard, it is necessary to establish what the causes of such negligence are. Whether is a lack of sufficient training a way of cutting costs for hospitals, a problem for access to pain medication, or a moral hazard that patients will get addicted to a certain type of drug. However, the economic issues should never stand in a way of proper treatment for hospitalized patients. In conclusion, I strongly support this petition and urge the Parliament to propose to the Commission the establishment of common European rules and to define minimum standards for the treatment of pain in medical facilities. Thank you for your attention. Lydia Geringer de Odenberg. Thank you very much.
Thank you. I need to ask something to Mr. Werner. It's not clear to me why the Commission cannot adopt guidelines in this sector. Why the Commission cannot foresee the introduction of uniform European procedures for chronic diseases, for chronic pain. Why? I think that the Commission can do that. I don't understand why the Commission can give resources to ONG and on the other side cannot state with general guidelines. Can you explain to me something?
Yeah, thank you, Madam Chair. If we talk about guidelines which would be endorsed by the European Commission or by the European Union, there is no procedure in that area. And this is mainly due to the fact that according to the Treaty of the Functioning of the European Union, the definition of health policies and the organization and delivery of health services and medical care is primarily the responsibility of member states. And therefore, member states would not agree to a procedure which would be endorsed by or just established by the Commission and then guidelines marked as European guidelines. They would not follow those guidelines. And therefore, we are approaching these problems in chronic diseases in general, but also now this would be a very special part in the pain problem by working together with non-governmental organizations and financing projects in these areas, especially on exchange of good practices in the chronic disease area through our health program. This does not mean that we are at the end would say this is now a European guideline. It would be just that these umbrella organizations in Europe would come to an agreement with all national sub-organizations in that area, and then there is a political momentum for those organizations to approach member state governments in order to implement what is set in those guidelines. Thank you.
I suggest that we leave this petition open and get some more clarification regarding the procedures, because I believe that we actually can do something on the European level.
I agree with you, and I think that even other colleagues can agree with you. So we will leave the petition open and we will ask for clarifications about these guidelines and about the adoption of general projects financed by the European Commission. So we can leave the petition open and we will decide on it later on. Thank you very much. Do you have something else to add? You have 1 minute to reply. Microphone, microphone. You have to use the microphone.
Chciałam po prostu powiedzieć, że nie można...
All I would like to say is that patients' rights are being infringed here. That is no different to a breach of human rights. Patients are humans after all. They are looking for access to painkillers, and if they're not being given such access, that is inhumane treatment. Thank you.
Yes, okay. Thank you again.